talk about the DNA fragmentation test, also called as DFI test. So ever wonder why some couples, in spite of having all the tests being normal, still suffer from infertility or have repeated treatment failures? Then it is time for the husband to undergo this sperm function test, and one such sperm function test is the DNA fragmentation index. For a healthy embryo to develop, it's important that the maternal chromosomes and the paternal chromosomes unite and forms a normal embryo, which is made up of a normal chromosomal pattern, for which the genetic material which the sperm is carrying is very important, and that should not have any fragmentation. Suppose if the sperms are having any such fragmentation of its DNA, it either results in fertilization failures or can result in poor quality of embryo formation or abnormality in the embryo formation, which can ultimately result in repeated IVF failures or recurrent pregnancy losses. So, does that mean that DFI test should be done for all men? The answer is no. So generally, the men will be subjected to a simple semen analysis, and it's important to know that about 30% of men with normal semen analysis can actually have abnormality in the sperm function test, that is elevated DNA fragmentation index. So in such men, definitely we can anticipate treatment failures or IVF failures or higher chances of pregnancy losses. So there are a set of men who should undergo this DNA fragmentation test along with their semen analysis, and these are men with advanced age of more than 40 who are trying to conceive, patients who are having varicocele, that is swelling in the scrotal regions, patients who are having long-standing diabetes, patients who are having a chronic history of alcoholism or smoking, or patients with repeated IUI or IVF failures, and patients who are having recurrent pregnancy losses. It is these men, although they are having a normal semen analysis, should undergo a DNA fragmentation test. So how do we interpret these results? So if your DNA fragmentation index comes less than 15%, it means that only less than 15% of the sperms are fragmented. So usually such men will have natural conceptions with the good outcome. Patients with 15 to 25 or 15 to 30 is called the gray zone, where such men usually benefit with IUI treatments or simple treatments with antioxidants and then natural trial. But patients with an elevated DNA fragmentation index, that is DFI of more than 25 or 30, are considered to be having higher DNA fragmentation index. In such men, IVF or ICSI is the treatment of choice in order to have good pregnancy outcomes through IVF and also decreases the chances of pregnancy losses. Hence, it's important for all men whom I referred to, those who are having associated disorders and all, to undergo a DNA fragmentation index. So consult your fertility specialist today and look into whether you require a DNA fragmentation index test.